So, hello everyone. A very good afternoon. A warm welcome on Homeopathy Musings platform. So, today we have with us Dr. Hiralal Agarwal, sir. He's a very senior homeopath practicing in Solapur. Sir will be taking session on evidence-based homeopathic approach for the acute illnesses, very different type of illnesses and acute illnesses where there is a scope of homeopathy and how to treat them. A short introduction by for Sir. Sir is a LCEH done from Dhondu Mama Sathe Homeopathic Medical College. Sir comes with a clinical experience of 39 years. Sir is practicing in Solapur at Sri Ram Homeopathic Clinic and Research Center. Sir is an ex-executive director of Indian branch of International Academy of Classical Homeopathy, Greece. Sir is a senior advisor to the Solapur Homeopathic Association. Sir comes with the experience of a professor at Mantedia Medica in GNR Homeopathic Medical College. Sir has conducted various homeopathic seminars and camps in Solapur city with late Dr. Prakash Vakil sir, who is a senior homeopath, Dr. C.C. Desai sir, and Praful Barwalia sir, and many more. Sir has conducted many free projects empowering communities through free homeopathic healthcare, special needs support, senior wellness, cancer relief camps, and holistic wellness programs. I welcome you, sir, on the behalf of Homeopathic Musings team, and thank you so much for accepting our invitation and sharing your knowledge and experience with us, sir. So before starting our today's session, I'll just give a quick look at our upcoming courses on the Homeopathy Musings platform. So we have a course on anxiety and panic with Dr. Aradhna Chitra ma'am, discovering a 360-degree homeopathic approach in treating cases of anxiety and panic. The course includes 4 sessions. We have already done 2 sessions. It's ongoing course, and we have 2 sessions remaining. If you want, you can still join, and the recordings of the previous session will be available. Then, as a part of our free sessions every month, ABC of Remedies, Season 2, by Dr. Preeti Shah and Dr. Prajakta Vaidya, our founders. This month, we have a session on 24th of July. It will be on Tarantula hispanica. We'll be learning a remedy in depth from our master. Then we have another interesting course coming, that is lanthanides by Dr. Jonathan Hardy, sir. There will be 4 sessions starting from 31st of July. The registrations are still going on, and it will be a very interesting course. And the lanthanides, it's like a very rare remedies from the Middle Kingdom. Then we have a very interesting course coming by Dr. Nandita Shah, who is a nutritionist come homeopath. Enhancing your practice, reverse the chronic diseases, which is very helpful along with homeopathy and with nutrition. So the course is coming in August. There will be 4 sessions, and the registrations are still going on. Do register. I would really recommend, because treating chronic cases is very difficult, and how nutrition can play this role. It's an easy and great opportunity to learn from them. Then we have a very clinical course, like a webinar, 2-hour session coming in the month of August by Dr. Ashok Borkar, sir, where sir will be taking a session on managing pathological advanced cases with homeopathy. Then we have a psychiatric course coming, that is practical application of homeopathy in psychotic disorders by Dr. Prajakta Vaidya ma'am and Dr. Preeti Shah ma'am. There will be 2 sessions in the month of September, that is 1st and 15th of September. The registrations are going on, and early bird offer is still going on and will be ending soon. Then we have a course that is basic course. After 3 versions, a successful 3 versions of this course, we are starting the 4th version this year with our renowned team of homeopaths, and it will be a 16-day practical course that demonstrates integration of classical and contemporary concepts of homeopathy. I would really recommend for those who, if you can share for those to the participants who are early practitioners and want to learn more about the homeopathy. And successing in practice. Then, before starting our today's session, I will give a quick basic hygiene factors. Please mute your lines all the while the speaker is speaking. Keep your videos on, which helps in the interaction, and avoid temptation. If you have any questions or queries, you can just raise your hand while the speaker is explaining. Otherwise, all the questions and comments will be addressed at the end of the section. You can just put it in the chat box. Please do not scribble on the screen, make notes, and share your experiences. Also, we have just launched our Musings website, exclusive Musings corner, where you can just enroll yourself and you can become a part of our community, homeopathic community, and you can just benefit of these perks as soon as possible. For any difficulties and questions or queries, you can just contact on this given contact details, and we'll be happy to share you and help. Thank you. I'll just not take much time, and I'll just stop the sharing, and we can just start the session. Hello, sir. I welcome you on the behalf of Homeopathy Musings team. So you have to just unmute yourself.
Voice is okay?
Yes, sir. It's perfectly fine.
Okay. So, very good afternoon. सगळ्या मुंबईकरांना आणि माझ्या होमिओपॅथिक बंधू भगिनींना खूप खूप हार्दिक नमस्कार. Thank you, Mansi, for your kind words about me. I have been associated with Dr. Pritisha and Prajakta Vaidya. We had a meeting also. Once we had met in Mumbai also. Since then, we were thinking of sharing our experiences. So today is the time that I have been fortunate enough on this good platform to share my experiences. Already, Bombay is a hub of homeopathy, and we in Solapur are part and parcel a very small portion of homeopathy that is working here. But the most of the stalwarts or maximum practitioners are in Bombay. Today, it's an afternoon. I feel everybody had their lunch, so nobody will be dull and silent. It is a two-way presentation where we will dialogue and interrogate with each other rather than I speaking only. So if you have any difficulties or problems, I think, as Mansi said, put that in the chat box, and at the end, we will take each and every question answers that are permitted and possible by the time period. So we start with today, evidence-based approach to acute illness. Now, acute illnesses are really a challenge to homeopathy. Why I feel this challenge? Because whatever in my 40 years of practice I have seen is homeopaths in general I say, try to avoid acutes, try to avoid sudden cases that have come up, and they are more stressing with chronic illnesses or chronic problems. And what people today want is they have to see the changes in the acute phase so that they should have that faith in homeopathy. If you want to inculcate the faith into the patients, the faith into the general public, the faith in the society, the faith in the government, you need to show results. बाप दाखव श्राद्ध कर असाही शो आहे हा. त्यामुळे if you are able to manage those acutes, I think you become a best master of homeopathy. You become a good teacher also, and you can say what you want to say because your understanding is very clear. So generally in acute cases, what we see is it's not a very lengthy procedure of acute case taking. There are very few presenting complaints with modalities because it's sudden, and it's said in books also, Acute cases are more clear in their presentation, more having clear causes as well as clear modalities and complaints. So you have to take the presenting complaints with the modalities. You have to see what is the cause of that situation. Suddenly it started yesterday, suddenly it started 2 days back or 1 day back. What is it? And then few generals of the case and the acute mental state. If you can match the whole scenario, I think that will give you the remedy, and it will take hardly few minutes to find out your remedy. So based on that, I have some few cases which I'll try to present with you, discuss with you. But these cases or videos that are there, one request is videos that are been which are been showing today are in the interest of learning. So if you have, there should not be any difficulty with anybody, or not leakage nor any transcription or recording of those videos. This is a sincere request to all our present day today's students or practitioners that are attending this seminar. So kindly do not do any videos, or do not discuss those cases by names. If you are some relatives, so don't discuss that. So we start with very simple cases. I think this everybody can understand. It's a small abscess which is there on the right upper eyelid, and which the doctor wanted to drain. As this was a very small child, they were a little bit, because they wanted to give a general anesthesia for that. It was not under local, so they opted homeopathy. And you can see the sign itself will tell you what should be the remedy. So any remedies, put in your chat box for case 1, what will be the remedies? Please, I'll be happy. Then only there will be some good interaction. So let me see some few answers, your remedies for that. Yes. How many attendants are there today? 44, 46, 56. So fast, you should be fast enough. You are there on the hot seat. I am there on the hot seat, but the question is, you have to put the remedies fast. Belladonna, Hiparsulf, Kalicarb, Belladonna. Belladonna, Hiparsulf. Okay. Now, Apis mellifica. So, whoever said belladonna is correct, because there is redness, dolor, calor, rubor, all the 3 inflammatory parts are there. Though you are seeing a small punctate where the pus has been formed, belladonna will take care of the pain and inflammation. And the next remedy after belladonna is not hipar, but plain simple sulfur, which will drain off the situation. So this was belladonna followed by hipar. So Hiparsulf would be very chilly. The child would have been taken a head cap and all those things, but the child was very hot. So it was belladonna followed by sulfur, which cleared up the whole scenario. So, sir, हे next कसा है? Yes. So this is a case of a roadside accident. The scooter tumbled off, and you can see the amount of hemorrhage that was there inside the knee. So it was a hemarthrosis of the knee joint, which they wanted to operate and remove the blood. The patient did not want it, because operation of the knee, he was a little bit reluctant. Again, homeopathy. So people don't come directly to homeopathy. They come when they feel that there is some problem. So remedies for this second case, fast. Deepti Gupta, Arnika. Only 2 people out of 56. So what potency? Potency is important now. Arnika, what potency? 1M, 30, 1M, 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 repeatedly. finished. 1m 30 and repeated. Why not 10m? Why not 10m? So it was arnica 10m repeatedly. It was not 1m or 30 repeatedly. It is arnica 10m repeatedly, which gave you a clarity in about 5 days of time. In 5 days, the whole scenario changed. So here you have to see the role of potency. You see, this is how learning of potency, selection of remedy has to be done. More acute, more clear the picture, and the patient has a good susceptibility and sensitivity, higher the potency. It was an acute, it was suddenness, and the patient is called also strong enough. Why 10m? I'm telling you 10m because it is a very immediate action. There is a lot of hemorrhage. We need to absorb the situation. So we need 10m frequently. Why? Because 10m will exhaust, one dose will exhaust immediately. It needs to absorb a lot of blood there. You see a lot of blood there, hemarthrosis. So you need a repetition of maybe 3 times to 4 times a day. This was 3 times a day. Or generally when we do like this, we take 4 teaspoons of water, we dissolve 1 10m pill in it, and then we tell them to take morning, afternoon, evening, night. So in 5 days, the whole of the knee was very much clear. Next case. So here again, injury to the eye. This was a farmer where a stick got hit in the eye with bleeding in the eye. Remedies? Yes. Put your remedies. Arnica, ruta, ledum.
Hello, sir, symphytum.
Symphytum, ledum, symphytum, bellis perinis, ledum. So here you see it was ledum followed by ruta. Ledum was 2 doses of 1m followed by ruta. Why ledum? Because it was a prick injury because of the stick. That was first thing. And second, the bleeding to absorb, it is more ruta. Symphytum will be used where you have more problem with the bones, where you want the bones to get joined or union of the bones, symphytum will be helpful. So bellis perinis more for the tissues, connective tissues and muscles. So here we wanted to absorb the blood, and it was an injury, a pinprick injury. So in 5 days to 7 days, the whole eye was clear off. So I think homeopathy is very still simple. We are making it more complicated. If you are with the patient, concentrating on the patient, our simple remedies given by Hahnemann can work till today very easily and without any difficulty. So what we need is to be very vigilant, observant, and concentrating on the patient and our materia medica. And with the materia medica, if you make your repertory very friendly, I think it will be more better. Next case. So this was acute gastroenteritis. You can see in the first before case that the child was admitted in the hospital, was given IV saline about 8 to 10, but still he was not recovering. The vomiting and diarrhea continued. He was a lot of dehydrated. It was from a very slum area. You can see that they could not have much money. So they took the discharge and brought to homeopathy as they were staying next door to me. We gave, it was acute vomiting and diarrhea because of the food and bad water. Remedies? Arsenic, arsenic, arsenic. So we are on arsenic. Now potencies, fast. Arsenic, everybody is good. The remedy is correct. Potencies now. 10m, 1m, 1m. Baptation arsenic 200. So it was arsenic 200 because the child was very weak, dehydrated. So his basic immunity, or we can say the susceptibility was good, but the sensitivity was So we gave 200 repeatedly, 2-hourly. And you can see in about 24 hours of time, the child was so good. In the whole of the night, after giving 1 hourly, next day morning, you can see the child was so good. So we can see the result before 24 hours. So this is the beauty of homeopathy. A correct remedy in the correct potency and a correct repetition. In acutes, it will show you wonderful results. So I feel that you should concentrate on your mater remedica that has already been given and taught, which will give you very good results. They are confirmed and proved. Next, please. Now, this is spot diagnosis. Chalo, we'll see diagnosis also. Right? What is the spot diagnosis? And that is why I have not written the diagnosis on the, not of the remedy, disease diagnosis. 56 participants, 61 participants are there. Contact dermatitis. Next. Question mark herpes. Herpes zoster. So it's herpes zoster definitely. Whoever have written herpes is quite correct. Herpes zoster, an acute herpes zoster with severe pain. And at that time, there was a very good strong fulminant of herpes. Now, rather than vesicles, there were pustules in it. You can see it's more of a pustular part rather than vesicular part. In generally, it's more vesicular. So the remedy was Rustox. In that phase of situation, Rustox was helping, and Rustox frequently, again potency was 30 potency frequently 4 to 5 times a day. In about 7 days, everything was cleared up. So you see before after, it's not a very big scenario. In a week's time, in 5 days time, in 24 hours, we are seeing the results. So this is how our simple remedies, regular remedies are helping me. Next remedies, please. Next diagnosis. What are these eruptions? Diagnosis. You can see the other child also. Next. They are both mother and son. Acne. The child had fever. The mother had fever. Fever with the eruptions that are there.
Chicken pox.
Correct. Who said that? There is no measles. It's chicken pox. So it was a chicken pox in the whole family, where you can see the vesicles here very clearly. In 5 days of Rustox, everything got cleared up, both the mother, child, father. So it was Rustox that helped at this juncture, both mother and child. Next, burns. Now burns. This was a simple burns that had come up, but a lot of pain, a lot of burning. Next, burns. These are 2 burns. This is what is the rule which is used in burns to find out how much amount of burn it is. What is the rule? Anybody? Which rule is used? Rule of 9. Yes. Shruti, Jyoti Vijay Kumar. So rule of 9. You have to apply rule of 9 to understand what is the quantity or amount of burn, the area of burn. So if you are handling something which it is beyond our capacity, so you should know your limitations also. If you are working in your limitations, 100% result. If you are not working in your limitations, you will fall back very badly. So it was in our limitation, and that is why we work with this case. Both cases, this was a very bad case of severe burning. So arsenic and cantheris, both were given in an alternating way. 1 hourly arsenic, 1 hourly alternate arsenic as well as lac-acid. Though
Potency?
Potency 200, medium potency. So here, after they had applied that, and the whole skin got peeled off. Otherwise, arsenic and cancer is given for burns. The first case that you see, first case that you see, the skin got blocked there only. It did not tear off. But in the second case, the skin got teared off because it got peeled off totally, because they had applied, and while cleaning it, the whole skin peeled off. But in both the cases, what we learned, that the pain was relieved immediately and it took some time for healing. So these were two acute burns that gave arsenic and cantharis a very good result.
No local application.
Sir, any local application?
They had applied already soframycin. So we said continue the same. So soframycin they continued, so we did not change anything. We only gave internal remedicine. Apart from that, they did not take any other medicine. That was true.
Sir, why arsenic?
Arsenic and cantharis both are there in burns because of the burning pain, right? Cantharis is there when you have a lot of vesicle formation. So here a big vesicle was there, where cantharis will make the vesicle don't break it open, but it stick it out. Here because they cleaned it, the skin came out. In the first case, the skin did not come out. It got stuck up there only. It got stuck up there only. So the wound was very small. The more the skin is attached to the skin, the wound will become less and the chances are infection of less. So that is why it is better that the skin is not peeled off. This is how they use more with the burns cases. The more the skin exposed, the more the chances of infection. So we have to see the infection also. Next. Now you see here, diagnosis.
Ringworm.
Ringworm. Yes, right there fast. You see now, this is the role of homeopathy, allopathy. You have to have diagnosis also, what we are having in hand. If you don't know what am I treating, how will you treat? Yes. 65 people, nobody, only one people said ringworm. These are warts, anal warts. The child is full of anal warts.
Warts.
Warts, anal warts. And the
Yes.
anal is fully closed. It's warts. How did you miss this? Remedies now? Tell me.
Hello, sir. Meadowrhinum.
Meadow. What else?
Puja.
Right there. Who said Thuja?
So
Meadow,
graphites.
Thuja. What else?
Graphites.
Graphites. Now you have to understand, this is a small child. This is since birth. Okay, I'll give you a clue also. This is since birth and
Anti-miasmatic.
the child is having it. So what will be the remedy? It was Thuja because
Psychotic miasm.
psychotic remedy since birth. So it's either Meadow or Thuja. There was a tie between Meadow or Thuja. But Thuja because the father also
How do you
multiple
differentiate?
warts, vicious, and all those things. So that is why we selected Thuja, and it took about 6 months to clear off the whole anal region. But slowly it went off. But in 6 months' time, though they had done a lot of what we can say burning of the warts and surgery of the warts, but it was becoming more bad. So this was after 6 months only Thuja. In
Potency and repetition.
30 TDS, then 200 TDS. This is how we went, and in 6 months' time, the whole anus got cleared up. Next case, please. Now this is fever and eruptions.
Blisters.
At the corner of the left. Blisters at the corner of the lip, left lip. Remedy?
Natromure.
Yes, Natromure is correct because there was headache, fever, chills, and all those things. So Natromure was the correct remedy. But because of the acute, 200 was the potency. Repeatedly, 4 times a day in 5 days, the whole vesicle got cleared up. Next. Ranula. Oh, I should not have spoken about this is ranula. This is a case of ranula. You can see under the tongue near, here is the ranula which went off. There is only one remedy in the rubric, if you can see. And
Yes, sir.
That was given. You see the change of ranula in about 2 weeks of time. It was not, though it is not an acute, but we are showing you the results also, how things move. Next. Yes, diagnosis. What are you seeing there? You see, in acute,
Thickly coated
observation is also very
tongue.
important. Huh?
Thickly coated tongue with tonsillitis.
Thickly coated tongue with tonsillitis. It's only simple tonsillitis.
Antimony.
Is it only simple tonsillitis?
No.
What you see?
Follicular.
Follicular tonsillitis. That is how you have to differentiate. Otherwise, you have remedies in your Mater Medica as well as in your repertory where it says tonsillitis, inflammation, or follicular tonsillitis, or septic tonsillitis. So you have to clear off. The moment you put on the torch in the throat, you have to see what is happening inside. So it's follicular tonsillitis. Next, you see, what do you see here?
Septic.
Septic what?
Tonsillitis.
It is septic tonsillitis, a very bad septicemia that the patient was having. She was already admitted in the hospital, taken IV saline, and so his septic state, the general septicemia was much better after the IV saline, IV antibiotics, and after about 10 to 15 days, she came to homeopathy. And when she came, she presented as a total pus pocket in the right tonsil. And what should be the remedy now?
Hiparsulf.
Huh?
Hiparsulf.
Hiparsulf. Tell the remedies. Put on your remedies. Pyrogen. Caries of the teeth. Caries nahi, septic tonsil. Right tonsil is septic. Silicea.
Merksol.
Merksol. Pyrogen. Now the phase of pyrogen has gone. It was the septic focus when the patient had chill, fever. That was the phase of pyrogen. So she's not coming in the phase of pyrogen. Correct? So pyrogen phase has gone. Now she has come only with the septic tonsil, which is not going after their antibiotics or medicines also. So what shall we do?
Sir, Merck protoiode.
Merck IF.
Merck IF. Why Merck IF? Baptasia. Baptasia phase also gone because the general septicemia has gone.
Right-sided.
Right-sided, and that is why Merck iodide flavors, because Merck has that tendency, syphilitic tendency of bad destruction.
Right-sided.
And that was a bad destruction, right-sided, left side did not affect at all. So Merck iodide flavors, Merck IF was the remedy which cleared off the whole of the patch, and you can see nothing remaining there. The whole throat became normal. So you see, your remedies can help you at any state of the pathology, provided at what stage you are handling them. Here she came after the relief of septicemia, but the local was very bad, and that is why we needed only Merck. Otherwise, she would need can be a need of pyrogen or hipar or streptococcin also. Streptococcin also is a good remedy, but here MIF helped the child, helped the patient very much.
What is the indication for streptococcin?
Streptococcin is against streptococcal infection, nothing else. There is no Mater Medica available. So
that's why. Yeah.
Sir,
yes,
what was the remedy for ranula?
Ranula baratacarb.
Okay, sir.
Now again a case of follicular tonsillitis. I showed you that another case. This is another case. A lady 36 years presented with complaints of throat pain after eating oily food, aggravated by cold drinks, aggravated by swallowing liquids, left ear obstruction, on examination, swelling of the left tonsil, follicular tonsillitis, appetite reduced, thirst is okay, sleep is okay. Next, pain in throat reduced after a week, and follicular swelling, no swelling now, no pain during swallowing, appetite increased, sleep better. Show the analysis. So this is the analysis. Throat inflammation, follicular, allergic constitution, antibiotic 2, allergic constitution, aspirin 2, medicine, allopathic, oversensitive 2. So what should be the remedy?
Pulsatilla.
Pulsatilla. What else? So this is the video of the patient. So this is an acute case. that has come today for homeopathy. Let's hear from her. What is her situation? बोला काय तक्रार आपली आणि कधीपासून?
सर्दी झाले, सर्दी खोकला, अंगात कणकणी भरपूर, अशक्तपणा जाणवलाय, तळहात तळपाय गरम आहे, डोकं पाठीमागचं दुखते, नसा दुखते कुठल्या हाताच्या पायाच्या, कणकणी भरपूर आहे.
कधीपासून?
2 महिने झाला.
काय केलं मग?
आयुर्वेदिक ट्रीटमेंट घेतली, 4-5 वेळेस केलं, काय कमी नाही, कायच कमी नाही. परत त्यांनी सांगितलं की होमिओपॅथीकडे जावा. आता माझ्याला काय होऊ शकत नाही.
ॲलोपॅथी काय घेतली नाही?
ऍलर्जी येते ना मला.
काय होतं ॲलोपॅथी?
पूर्ण स्किन जाते त्याच्यावरची.
बरं. कधीपासून आहे असं?
2016 पासून.
त्याच्या आधी काही नाही?
त्याच्या आधी काहीच नाही.
कुठली गोळी अशी एखादं सल्फाड्रग चालत? इज द व्हॉइस क्लिअर ऑफ द व्हिडिओ?
कुठलं पण काय पण खावा रिएक्शनच येते.
तापाची गोळी नाही?
तापाची नाही, काय नाही. सगळं इतके दिवस आयुर्वेदिक वरच इलाज होता. ताप आला.
इज द व्हॉइस क्लिअर ऑफ द व्हिडिओ?
Yes, sir.
I will put questions after the video.
आडा करून आहे.
2016च्या आधी काहीच
काहीच
आता एक सुद्धा कसली गोळी चालू?
हा, आता काहीच नाही.
काय सगळं सालपट निघून?
सालपट निघून जाते, परत रॅशेस येते, थंडी, ताप, पेशा वाढते, ऍडमिटच करावं लागतं.
थोडं
हा, मग 1 महिनाभर झोपूनच कंटिन्यू, अंगात काय अवसानच राहत नाही.
पण आता तसं काही नाही, पण हे ताप आता
हा, सर्दी ताप आता कमी नाही, कारण ते गोळीच घेतली नाही ना. गोळी घेतली असतं तर रिॲक्शन आला असतं.
नाक चोंदतं का? नाक
नाक चोंद.
पाण्याची ताण कशी?
चांगली छान लागते. तोंडाची चव नाही, कडू लागायला.
कडू आहे? सगळंच कडू लागतं?
हा, सगळंच कडू लागलं. भूक लागायला पण जेवण जात नाही, काहीच काम करू वाटत नाही, सारखं झोपा वाटतं.
पंखा पाहिजे नाही?
हा, पंखा पाहिजे.
नसेल तर काय?
काय नाही होत नसेल.
जवळजवळ कुठे?
जर तळपायात तळहातात.
काय करावं?
गार ठिकाणी पाय ठेवा वाटतं. एक दिवसानच नाही.
पहिल्यापासून?
हा, पहिल्यापासून.
आता सध्या काहीच घेत
नाही.
घशात काही होतं का तुम्हाला?
घशात दुखते थोडं.
कधी दुखतं?
गिळताना आहे ते खवखव व्हायचं, म्हणजे सर्दी खोकला झाल्यापासून दुखायचं.
2 महिने झाले?
हा.
आता जर असं तुमची गिळ त्रास होईल का?
नाही.
कधी दुखतं?
कधी तर दुखते.
कधी तर दुखतं. बघू बरं कसा वॅक्युम मारलं. आवाज करा, मोठा आवाज करा. This is the follow-up of the case which had come on 19/3, around a week back for a acute court. So we'll hear from her what happened. बोला, 19 तारखेला औषध नेलं होतं. काय झालं त्याच्यानंतर? कशामध्ये?
घसा दुखायचं कमी झालाय,
औषध सुरू केल्यानंतर 19 तारखेला तुम्हाला कधीपासून तुम्हाला बरं वाटू लागलं?
3 दिवसानंतर.
पहिले 3 दिवस काही जाणवलं का? आहे तेवढंच होतं का वाढलं होतं? वाढलं पण नाही, कमी नाही. 3 दिवसानंतर पहिल्यांदा काय कमी झालं?
घसा ओढायचा कमी झाला.
घसा ओढायचा कमी झाला. मग
3 दिवस चालू केल्यानंतर डोकं
अजून फक्त डोकं दुखतं. ताप बाप काय वाढला? बरं, मग काय झालं पुढं? काही घेतलं त्याच्याकरता? मग आपणच कमी झालं. किती दिवसांनी कमी झालं?
4थ्या दिवशी फरक पडला.
मग ते डोकंही कमी झालं आणि बाकीच्या गोष्टी कमी झाल्या. मला तर नाक चोंदत होतं तुमचं अल्टरनेट साईड. त्याचं काय?
थोडं राहिले,
पण तसंच आहे. अल्टीपल्टी कंपनी हे
नाही आता. फक्त कानात थोडा सोडल्यासारखं.
नाक चोंदायचं बंद झालं का? तेव्हा नाक चोंदत होतं, एकदा हे एकदा हे. ते किती कमी आहे? पूर्णच कमी. त्याला किती दिवस झाले कमी?
त्याला 2 दिवस झाले.
2 दिवस झाले. कान डावा तुमचा बंद पडला?
हा, बंद. आता उघडले ते, ऐकायला येत नव्हतं, काय ऐकायला आले, पण मधून अजून दुखते थोडं.
अजून दुखतंय. घशाचं काय?
घशाचं पण थोडं ओढल्यासारखं. तेवढं कमी नाही, 50% आहे.
अंगात कणकण जाणवायची?
हा, आता कमी.
कमी. खोकला होता? खोकला, दम?
खोकला थोडा यायला आता.
दिन काय तेलकट खाल्ल्यावरती काय खोकला आला, नाहीतर नव्हतं. दम आणि चक्कर
चक्कर पण नाही आता, दम पण थोडं कमी वाटत.
तोंडात चव कशी आता,
चव चांगली आता,
नाहीतर पूर्ण कडू होतं, खूप पाणी सुद्धा कडू वाटायचं.
चव पण चांगली आता. तास टोचल्यासारखं व्हायला पायात.
कुठे
दोन्ही पायात
टोचल्यासारखं आहे. पूर्वी तुम्हाला गरम वाटत होतं, गरम वाटत होतं ना पाय, असे गार शॉर्ट होता, पण टोचा नाही. तो गरमपणा गेला का?
गरमपणा पण आहे.
तेवढाच आहे, कमी आहे, जास्त आहे?
कमी वाटत.
भूक लागते, लागत नाही?
भूक लागत.
भूक नाही तर लागत नव्हती. पण सगळं साफ आहे, त्यांना साफ होते का? पण एक दिवस आड व्हायची.
गोळ्या घेतल्यानंतर
रोज आलेली का? बघू तुमचा कसा. आवाज करा, करा आवाज. हा करा आवाज इथला, करा आवाज, करा करा. अजूनही इथं आहे चट्टा, करा करा करा. करा एकदम मोठा. हा, कॅन यू सी दॅट? आता तेवढा जरी तो चट्टा आहे तरी कमी आलाय, है ना? एकंदरीत किती बरं वाटतं रुपयामध्ये? 8. आणि तुम्हाला कुठली ॲलोपॅथी गोळी चालत नाही? ठीक, देतो औषध. What should be the remedy? I am showing you the analysis also. Where is the group? All are silent. Are they sleeping? 65 people. Hello?
Nakswamika.
Nakswamika. You are not drowsy, na? Nobody is drowsy. Nakswamika. Next, what else?
Sulfur.
Sulfur. What else? Nakswamika, not drowsy. Calcarea carp. You can see from the follow-up, though it is an acute on chronic, she had a chronic situation which had come with an acute left-sided follicular tonsillitis. You saw in the follow-up, there was still the follicle still remaining there. Okay. But her generals and locals all improved. Apart from Nux, calcarea carb, anything else? My analysis is being displayed. Can you see the analysis? Yes or no? Hello?
Yes, sir.
So, where is Nux vomica? Where is sulfur? Somebody had said pulsatilla before. The whole group is silent.
Pulsatilla.
It was penicillin that was given.
Penicillin, I thought so.
Penicillin
What is the
therapy was
indication?
given.
Indication for penicillin, sir?
You can see first, did you first understand what is the case? See the amount of sensitivity the patient had for allopathic medication. You see,
Yeah.
it's not just that because I take one painkiller, I'm taking constantly, my abdomen is disturbed, you cannot take that. The amount of sensitivity to allopathic medicine, the whole skin burns out, there is a lot of rash, she needs to get admitted in the hospital. Okay. So that amount of sensitivity the lady is having. And now, there are two things which penicillin was covering here. One was follicular tonsillitis and the second was sensitivity to the antibiotics or allopathic medication, right? So now, seeing these two things, because we wanted to take the pathology into consideration, I took penicillin. Sulfur is not there in follicular tonsillitis, nor any other remedy is there. She is away from pulsatilla in some phases of period, though she says that oily food aggravates. Now also in the follow-up, she said that oily food aggravates her. So somewhere she is pulsatilla, but her thirst is very much strong. She is not thirstless. So now at present, the phase of pulsatilla was not there. Acute, it was penicillin 30, 3 times a day for 5 days. And that is the follow-up after penicillin. After penicillin, even the burning pain of the soul went away. So now here, this is the research for homeopathy that we should do. What should be the streptomycin or streptococcin modalities? What are the drug picture of penicillin or streptococcin? We can see many of these remedies have been not proved, but now clinical proving or clinical symptoms we should add to our materia medica, and this is the sharing of experience. Even I have seen penicillin working very strongly when there is a lot of mucus in the throat. People come with chronic rhinitis, lot of severe catarrh, postnasal catarrh, lot of discharge from the nose, lot of ear discharges. You can see penicillin working very beautifully. Give penicillin 33 times a day for 5 to 7 days. All general practitioners who are giving homeopathy in their general practice or allopathy in their general practice, whenever you have this chronic catarrh, penicillin is one of the best remedies that I have been using for chronic infections or chronic discharges which are not responding to our medications. So this is the case of penicillin followed by sulfur. Clear?
Yes, sir.
So this is a case of cough. 30 years old lady presented with complaints of dry cough. Dry cough since 2 months, taken all allopathic treatment, reports done which were normal. Dry cough emulated by cold water, aggravated by lying, aggravated by head touching the pillow, chest pain during coughing, irritation and pain in throat, appetite okay, thirst increased for cold water, sleep disturbed due to cough. Now follow up after 5 days, pain better, irritation of throat, better in chest pain, which is aggravated by coughing, cough completely better, no other complaint, appetite increased, thus better, sleep better. Now here also you have to see the video and you should tell me the remedy. You see the face, you see observations are very important here. We talk about observation, see the face, see the glow on the face. See her nose. See her sternal notch.
सर्दी खोकल्याने चालू झाली. This is the X-ray report that has been done. It shows normalcy, nothing in the throat. These are blood reports that has been done.
Hello, sir. We cannot hear the audio. Audio is not very clear.
Audio is not clear.
Yeah, there was some issue with the hearing.
She lies down.
Now you see.
Increases immediately. झोपले की काय होतात. सतत चालू. कशात खवखव नंतर काय करतं का. इतर झोपू शकता असं. Follow up of case number 190, which had come with an acute 5 days back. He had a cough of 2 months. बोला 5 दिवसापूर्वी आला होता.
आवाज बारीक का होता
औषध घेतलं
नाम काहीच नाही. टाइमवर 3 टाइम औषध घेतलं ना काहीच नाही. मग काल औषध संपलं, आजपासून परत चालू झालं.
आजपासून जे सुरू झालं ते आहे कुठल्या पहिले
म्हणजे आता स्टार्टिंग म्हणजे सुरू झालं थोडं थोडं.
पहिल्या एवढा आहे का.
नाही तेवढं नाहीये, थोडं कमी आहे.
त्यात फोटो करतो ते काय
थोडंसं आहे ते पण कमी आहे. आता खोकल्यावर दुखायला. आधी असं नॉर्मल दुखायचं. हा खोकला चालू आहे. आता नाही. 5 दिवस झोप आली. हो. मला गोळ्या खाल्ल्या तेव्हापासूनच खोकला थांबला. हो त्या दिवशी सेम. हो कमी झाला. हा खाल्लं तेवढंच कमी होतं तर परत चालू. हे आपले 5 दिवस मला हा आडवं नाही. हो. त्रास
Yes, tell me, what do you see the change in the case in 5 days? The facial picture, the face of the lady, what was before 5 days, what is after next 5 days. This is acute only because though she was taking allopathy for last 2 months, she was still not out of the situation. Barking cough, verbascum, spongia, antiumtat, bryonia,
Drosera.
What else? Phosphorus,
Spongia.
spongia. Why spongia? Fast. You should be fast. In 5 minutes, we should finish the case. We should not linger so much. We are now quite good homeopaths. We should present. If you have started clearing such cases, I think then we can treat difficult cases of cancer, pneumonia, hip joint disease, and all these things. If you are unable to treat such small cases, then it's very difficult to go in for difficult cases. Why? Barking. What else? Barking, you have all remedies for barking. You have spongia, you have drosera, you have phosphorus, you have hipar. Why you choose spongia as the remedy?
Retrosternal. There's a
Retrosternal. What retrosternal? What was the modality?
lying down
Lying
aggravation.
down aggravation. What else? She could not lie down for 2 minutes also. The moment she lie down, she used to get up. And what was the modality? Better by cold water, ice cold water. What else? Did you hear the cough? When she first lied down, did you hear the cough? It was a barking cough. So what should be the remedy? Phos, causticum. How will you differentiate causticum and phosphorus? Fast. This is how you will learn.
Better by drinking water. Causticum.
Both are better by drinking water. Phos is also better by drinking water. Phos also needs ice cold water. Causticum also needs ice cold water. You need in Phos lot of hoarseness of voice. Last 2 months she is suffering
Painless
from cough.
hoarseness.
There is no hoarseness at voice. There was no hoarseness. Only the cough was barking. Okay. So the major thing is there was no hoarseness of voice, though she is suffering with cough last 2 months. Otherwise, even in talking, there should have been hoarseness. Okay, that is not there. What else? But the cough was better by drinking cold water. What is the remedy? Drosera. The moment the head touches the pillow, the cough starts. So the moment she lied down, we saw that modality by making the first video. When the moment she lied down, she started coughing, and it was a barking cough. Cough aggravated by touching the pillow, better by cold water, and the cough is barking. The only remedy is Drosera, no else. Drosera 1 ml, 3 doses, and you can see the whole change that is there today. Clear?
Yes, sir.
Next. Chronic tonsillitis. This is a case of chronic tonsillitis with now has come up with an acute lymphadenopathy. So chronic tonsillitis, this is again acute on chronic. chronic tonsillitis but with acute lymphadenopathy.
क्या होता है बोलो बेटे?
ये सूज कर दिखता है, इधर कट कट है, उसकी वजह से पूरा इधर दिखता है।
कब से हो गया ये?
एक हफ्ता हुआ, मंडे से।
एक हफ्ता हो गया? तो मेरे पास कल आया था।
हम्म।
एक हफ्ता क्या किए थे?
एक हफ्ता इतना था, अभी कल रात से ये बड़ा हुआ।
तो एक हफ्ते से चौपानी पा रहा था देखो। बुखार है क्या?
थोड़ी थोड़ी।
ठंडी बज रही क्या?
नहीं।
ऊपर का बज रहा हो, कहाँ दुखता हो रहा है? निकलने को तकलीफ होती क्या? कितना हो दुखता हूँ तेरा? कितना दुखता? क्या खाया सुबह से?
पोहे।
और
कुछ नहीं।
पानी कितना पी रहा है? पानी प्यास
पानी पीता।
प्यास लग रही कि नहीं लग रही?
लगती।
नींद लगी क्या रात को? खाना ठीक हुआ क्या? अब ये सब पंखा है, होना कि नहीं होना? होना कि नहीं होना? होना। Then also see, हाथ लगाने देता नहीं लगाने देता? Right side is more strong. Definitely this is more than war. सब
Danish shape.
Yes. What is the remedy you have in mind? What are the things you are seeing here? You should gallop on. There are few more good cases. Otherwise, we will miss those cases. And that I have brought two videos. Phytolacca. Yes.
Merck bin iode.
Merck bin iode. Baratakar. Baratakar was been given so long for his chronic tonsillitis. Baratakar was the remedy. But now he came with an acute situation with a whole lymphadenopathy, submental nodes, swelling of the chin area and all those things. Now you see the follow-up.
पेपर नंबर 4808 लेफ्ट साइड का थोड़ा ये कम हुआ है, लेकिन गांठ यहाँ पे थोड़ी दिख रही है। ये वाली गांठ दिख रही है, ये पूरा जगह कम है। और राइट साइड में सूजन है थोड़ी, और ये जो रेड जो था ना वो कम हो गया, नीचे सूजन है। और रात को सोए से था, बुखार नहीं है, खाना भी खाया सुबह में, इतना मुंह खुल रहा है ना, तो
See the opening of the mouth. It means the swelling has reduced quite well.
और ये जो चेस्ट इधर का ये पेन बोल रहा था ना, जो पेन बोल रहा था, तो वो पेन भी नहीं है कुछ भी। और इधर भी कुछ पेन नहीं है, इधर ये साइड में भी कुछ पेन नहीं है। कम होता है वो क्या मुंह पर।
This case has come for follow-up, the acute lymphadenopathy, chronic tonsillitis. So it's one day again, 24 hours. Let's see. बोलो कैसा है हीरो, कैसा है चैंपियन? क्या क्या हो तेरे को? बोला भी तेरे क्या हो रहा?
खुजारा बस।
कहाँ खुजारा? कुत्ता है।
You say, he says now from pain it has come to itching. So it's more superficial now.
दर्द है क्या अभी?
नहीं।
ऊपर का
थोड़ा
ये दुखता क्या? थोड़ा लाल है। ये इधर दुखता था वो कैसा है? ये पूरा कम है क्या? इधर का इधर क्या भी नहीं है अभी, है ना? ये बाजू पे भी गया ना, तो इधर था ना गट्टू, पूरा गया नहीं ये अंदर, सिर्फ अभी इतना चाहिए। ये भी ड्राइनेस कम हो गया, ये तो पूरा सूखा था। घर में तो उससे भी कम था, ड्राइनेस कल कम था, स्कूल जाने की वजह से। स्कूल जाके आया क्या? अरे वाह, कौन से स्कूल में है? LFC। हाँ, बड़ा भी मुंह कितना खुल रहा? बस इतना आवाज कर। जुबान आवाज कर, आवाज कर, आवाज कर। गले में दुखता क्या? नहीं। खाना खाया क्या सुबह से? पेट साफ हुआ क्या? निकलने कुछ तकलीफ है क्या आपको? हाँ, निकलने की तकलीफ है, क्या होता है निकलने में? थूके निकलने में दुखता, क्या पानी निकलने में, क्या खाना निकलने में? थूके को नहीं, ऐसे एम्प्टी swallowing को नहीं, सिर्फ खाना गिलने को। गले को थंडा गरम क्या अच्छा लगता? गरम। 2 दिवसात 3 दिवसात काही एलोपॅथी दिली का? फक्त आमचं औषध आहे, पाण्यातच देत होता, बरोबर आहे ना? एलोपॅथी तापाची नाही, मणक्याची नाही, अँटीबायोटिक नाही, काय नाही, काय नाही, बरोबर ना? हा, गेला तर नंदी
दानिश शेख, केस पेपर नंबर 4808। ये यहाँ पे गांठ हो गई थी, तो यहाँ पे थोड़ा कम हो गया है, इधर ऊपर का, इधर तो अभी थोड़ी दिख रही है। और जो रेड था वो कम हो गया है, और सिर्फ थोड़े टॉन्सिल सूजे हुए हैं, इधर थोड़े टॉन्सिल सूजे हुए हैं, इधर भी, और इधर थोड़े टॉन्सिल सूजे हुए हैं। बाकी सब इधर की जो सूजन थी, इधर की सूजन जो थी वो सब कम हो गई है, और रेड कलर का भी कम हो गया है, और बात करने आ रहा है, मुंह भी खोल रहा है, लेकिन सिर्फ खाना नहीं खा रहा है, भूख नहीं लग रही, ये कह रहा है।
Chalo, tell me now, what have you understood in this case? I have shown you 4 follow-ups every 24 hours. You can see in 4 days, the child is totally out. On the 3rd day, he went to the school. 4th day, he is totally fine. So this amount of lymphadenopathy, though the chronic situation of the tonsils, you can see on the 4th day, both of the tonsillar fossa, they are still enlarged. So the tonsils are there, but the lymphadenopathy gone in 3 days. So what is your understanding? Fast. I am hungry now. I have not eaten my food. It's already, you might have taken your food and come back. So I'm hungry now. I have to go fast. Tell me, there are 2 more cases. We have to finish that. If you are interested, everybody is tired and not seeing anything on the board. Only hip herself. Yes, you are not sleeping now. I have to see your videos. What are you sleeping or sitting? Are you hearing me? Hello?
Yes, sir.
So no answers, nothing, no voice. What happened? Your understanding of this case, fast. Not understood? This is the analysis. Swelling sublingual gland, submaxillary gland, submental gland, painful, submental gland, and inflammation parotid gland.
What is it, sir?
Is it not clear? There are all acute symptoms that have been taken. Swelling of the sublingual gland. Is it not clear? The slide is not clear?
No, sir.
You cannot see the slide?
Enlarge it, sir, please.
Yeah, we
You
can
cannot enlarge
see.
it. This is already enlarged. There are 5 symptoms which have been taken. Swelling of the sublingual gland, swelling of the submaxillary gland, swelling submental gland, which is painful, swelling submental gland, and inflammation parotid gland. This is the analysis. You have conium, ammonium carb, merc, bromium, calcarea, natramur, graphite, staphysageria, and ledum pal, and also baryta carb. What shall we start with?
Baryta carb.
Baryta carb. It has already been given so long. What is called tonsillitis.
Marksol.
Merxol. Merxol is not there in the, it is there on the 3rd rank. Yes.
One I am. Because
Your
all bromium.
observation has to be very clear.
Bromium.
Bromium. What else? Bromium has painless glands. Here,
painful.
It's painful. So you have to be very, very conscious.
Ammonium
Whole scenario changed. I'll cut short the story because we have to go fast. We gave him ammonium
Graphite.
carb. Why ammonium carb? Because the whole scenario came up. We took the 3rd rubric as swelling, submental gland painful. It was very clear. It was very red. It was very painful. Rest of the glands were not painful, though they were there, but they were not painful. The whole scenario comes in submental gland painful, and that became, what is that rubric called? Eliminating rubric. It eliminated all the other remedies, because that is the only remedy which is there in painful submental gland. It is ammonium carb. Ammonium carb is only taking care of all other the glands, and so we gave ammonium carb. Ammonium carb 30 4 times a day for the whole of the week, and you can see what happened in 4 days. So it was ammonium carb. So that is why your remedies, your rubrics are important. You have to refer not only the materia medica, but the repertory also. If you are very much playing with the materia medica, if you see ammonium carb, you don't have much of glandular swellings or pain. You have more of cardiac and respiratory symptomatology, where you have nose obstruction. So, but here with painful submental gland, only one rubric, single rubric remedy, a rubric with single remedy. That is why single rubric remedies are important, and the whole scenario was cleared up by ammonium carb in 5 days. So this is the importance of single rubric remedies as well as the acute observation. Your observation has to be very clear. Now, this is the case of otitis media.
Which potency given?
Any questions? Potency 30.
So how much was it repeated? For how long we gave ammonium carb? Because it's a rare prescription.
34 times a day for 5 days. And you saw every 24 hours the change in him.
Okay.
Ammonium carb 34 times a day.
Very rare prescription.
Very rare prescription. But that prescription came because of the repertory.
Elimination. Yes.
And
Okay,
that it gave an eliminating rubric. You have to be very clear, because you see submental gland was painful. No other gland was painful. They were just swelling. It was very red and it was very painful. So we have to take into consideration that part of the story. So where to keep our eyes, that is very important. We have to be very vigilant and cautious during seeing our patients. So this is an acute otitis media. Then you have a mumps going to meningitis, and then we have a severe acute bronchitis. What is the time now? 3:17. Shall we go with this case? But we'll go fast. Okay. This is an acute otitis media. Boy present with complaints of high-grade fever. 7 years old child on 18th February. Evening at high-grade fever with cold, restlessness, tossing his body. On examination, severe pharyngitis, thirst normal, no nausea, no gastric complaints. Urine, stool normal, given tuberculinum. The mother of the child is a homeopath. She's a good homeopath, and she tried to treat her son, but whenever was in difficulty, used to come to me. So tuberculum 200, 2 doses, 2 hourly apart. Next day, 19th February, morning he was okay, took his food. Mild coryza at night. 1 a.m. again, high-grade fever around 104. Started giving aconite 13 water along with calpol, and fever subsided at 6 a.m. Then he had again high fever, sudden severe left earache, aggravated in the night, restlessness, tossing body, void-coated tongue with nausea, pain in the left throat. All complaints aggravated at night between 12 to 2 a.m. On examination, ear discharge, ear catarrh. 20th February, whole day, febrile at night, 8 p.m. Again, high-grade fever started. Head hot with cold extremities. Thus, belladonna 200 given water 2 hourly, but fever continued up to 6 a.m. And the child was febrile whole day. So it means the child had fever only at the night, and he was febrile in the whole of the day. Whatever you give or you don't give, the fever was same. Evening case discussed with me, and on examination, left tonsillitis was seen. Sulfur iode 200 3 times a day for 2 days was given. Fever pattern was same, daytime febrile, and after 8 p.m. to 6 a.m. high-grade fever. So given Taxim O 100 milligram BD for 3 days. The night fever subsided. but only left ear pain started only at night at the same time. Then discuss the case with me, advise sulfur 203 doses, but next day, same episode. Reanalyze the case on 22nd February. We caught the following symptoms: salivation during sleep and perspiration on the head always. Thus, Merxol 13 water 2 hourly was given and ear pain subsided for 2 hours. Only then next day, Merxol 200 in water 2 hourly was given, but ear pain was there with less intensity but could not sleep. So Merxol 1 mg 2 doses were given in daytime, and the same day night had ear discharge which was yellowish and very sticky, no odor but no pain. Painless whole day and pain at night. Only thus Cifalinum 202 doses were given, but ear pain persisted in less intensity but no discharge. Thus consulted ENT surgeon who diagnosed it as acute otitis media and advised antibiotics. So rather than giving antibiotics, because she had already given Taxim O, now we said that we will go to homeopathy. So here we took acute ear inflammation, acute, only streptococcin and streptoenterococcin. There were only 2 remedies. And ear inflammation suppurative, it was arnica, capsicum, sorinum, silica, sulfur, and tuberculinum. So what shall we do? Streptococcin 202 doses given, slept first time very well, no pain whole night. 24th and 26th was okay with no medicine and advised to see the ENT surgeon who examined and said it's not otitis but ear catarrh. Then decided to give sulfur 1 mg and 200 1 dose each. So these are the reports before and after. So here again, streptococcin came into play. You asked why streptococcin. So acute inflammation of the throat or of the ears specifically, if you see the rubrics are given there. So being in close connection with your repertory will give you an understanding of all these various sarcodes also. So you have to see how these remedies can be used: penicillin, streptococcin, staphylococcin, including bowel nosodes. Bowel nosodes are also important, but when you go close to your repertory, when is to be psychotico, when to use psychotico, when to use Morgan Pure. For chest congestion in children specifically, Morgan Pure is the best remedy. Morgan Pure, if you give for children and infants, chest congestion goes more better than bacillinum and tuberculinum. So here now this whole
What potency?
200.
Okay. Thank you,
Now
sir.
here the case itself is the whole video itself is the case. Now I have not written the case separately. It's a case mumps with meningitis. So here the case very clearly.
The child is the patient and it is an acute case. Just hear from the mother what is the problem. काय तक्रार आहे हिरोची? काय त्रास झाला कालपासून? ताप आणि हे काय सांगायचं? कधीपासून आली आहे? काल. आणि जेवत नाहीये, बाकी काही त्रास नाही. आपण महाराज पाण्याची ताण आहे का? पाण्याची ताण हो आहे. शांत आहे, चिडचिड आहे. चिडचिड आहे. कोणतरी घेऊन बसा म्हणतो का एकटा पडून असतो? सकाळपासून काही खाल्लाय का? आधी पोळी खाल्ली. पंखा वारा पाहिजे नाही पाहिजे? काल कसं सुरू झालं? काय पण काही खाण्यात आलं का? आईस्क्रीम वगैरे खाल्लं. कधी खाल्लं? 4-8 दिवसापूर्वीच असेल तर काय? काल हे सुरू होण्याच्या आधी काही खाल्लं का? थंड वगैरे उन्हात जाऊन गार पाणी बिणी पिलं का? तुला काय होतंय श्रेयान? सांग बर. कुठं दुखतंय? अजून काय? हाताला काय झालं तुझ्या? फ्रॅक्चर झालं. कसं झालं फ्रॅक्चर? बेंच तोडून आला का? तोडला बेंच? आतापासूनच बेंच तुटू लागला. रक्त कधी आला म्हणला तुम्ही? 29. आता या महिन्यात अचानकच झालं.
रात्री सकाळी उठायच्या आधी म्हणजे उठल्यावर त्याचा काही तुटलेलं डाग बेडशीटला ते लागलं.
असं काय फार उघड नव्हतं
नाही
थोडसा कुठल्या नागपुरीत ना डोळे का पाणवले त्याच्यात ते जरा बॅटरी कमी. पण रात्री नाक बंद पडतं का त्याच?
नाही आता एवढं नाही.
So what he had inflammation of the parotid gland. The left side was very much prominent and very clear. And what the lady said is, nose epistaxis in the whole of the month, thrice he had, though in the night, and it was mostly in the night and on the left sided. So these are the three things we took. Remedies: Rustox, Bromium, Lachesis, Merc, Bryonian, Causticum. What shall we do? What should be the first remedy then? Yes. Lachesis, Gandhi, Jayakumar Gandhi, Lachesis. Lachesis. What else? Bromium. Again, bromium is painless. Here you have pain, Baba. Lachesis was given because it's left-sided again, and he had history of epistaxis. So this both continuation shows that it was more lachesis. So lachesis 203 doses were given. We'll see what happened further.
त्यानं तुला बरं वाटतंय कालपेक्षा? आकर मोठा आ करताना दुखतंय? हात लावल्यावर दुखतंय? नाही. बघू खाली बघ. असं सरळ बघ.
You can see the swelling still that is there.
सूज आहे थोडी. आणि नाकातून रक्त आलंय. डाव्या काल आणि आज.
This is good or bad?
Good.
Gave lachesis. This is good or bad? Now we have to analyze
Good, sir.
what is your remedy doing, whether we are going in a right direction or a wrong direction. Is this epistaxis good or bad? Yes, out of 62 people, nobody is answering. Are they Mansi?
Sir.
Good. Why
Yes,
good?
sir.
Are our whole of the group sleeping? They are very
Anytime.
silent. Why is it good? Child appears alert. What else?
General condition is fine.
General condition is fine. And whatever the congestion was there, it had once only drained off. Only because in the whole of the month, twice or thrice, the left nose bleeded very less at night. So this time after lachesis, whatever congestion was there, everything the body threw it away and made the patient more better in general as well as more alert.
आणि तुला ताप नाही ना?
So this is the vomiting, second follow-up after 5 days. He had severe fever, headache, and a bad vomiting. Now you see. See his face, see his look.
सांग मला अजून काय आहे बघू लांब कर पाणी पितो का? ताण लागते का? डोकं पुढं कर. असं करतो. कुठून बस बरं जरा. हा बसलं की चांगला असं करायचं. काय करायचं नाही, असं करायचं नाही. तोंड बंद करून कर. तोंड बंद करून किती करता येईल बघू तर खरं. म्हणजे तू जास्त केला तर बरा झाला. कर बरं किती करता येतं.
So now, after 5 days, he had this headache, mild fever, and neck stiffness with a strong vomiting that was there. So this was parotid inflammation, meningitis threatening, and parotid gland metastasis to the brain. It was a question. Now, even we had consulted, or they had consulted a pediatrician. He said he needs to get admitted fast and his lumbar puncture to be done and the CSF to be sent for further evaluation, and then only we can say. But clinically, he was having a threatening meningitis. It was not a very clear meningitis, but a threatening meningitis. So the remedy here, only one remedy was very clear, was gelsemium rather than jaborandi. We gave gelsemium, and you can see what happened after gelsemium.
बरं वाटतंय का तुला? कुठं दुखतंय? खूप दुखतंय का? कालपेक्षा थोडं बरं आहे? आणि इथे कपाळ मागे दुखायला लागलंय. कालच्या सारखं हनुवटी लावून दाखव बरं. आ न करता प्रयत्न कर. खाली बघून प्रयत्न कर थोडं, जितकं होतं तितकं. हे नको छाती असं करू. छाती असं सरळच ठेव. फक्त डोकं असं खाली हनुवटी टेकून. काय करून दाखवू जी?
What are the things you have seen? What is the change after gelsemium 30?
Drowsiness reduced,
Yes.
stiffness reduced, occipital pain reduced, sensitivity to occipital region reduced.
But very less, 10%. He is not that still, he is unable to put his chin in the notch. So the stiffness is still there, the headache is still there, but the intensity is less. And in general, a shade better. So it was gelsemium 30. So what do we do next?
Go for 200.
Correct. So 200 was given. You will see what happened after 200. That dullness, drowsiness is there, you see. And that is why we took gelsemium. These were the reports that were done. Albumin protein plus 11.6, 7,000 is the count. Desires alone, irritable desires activity, a complementary to the first remedy.
बरं वाटतंय? खूप बरं वाटतंय. डोकं दुखायचं मागे पुढे आणि उलटी आणि ताप आणि हनुवटी दाखव बरं असं टेकून. खांदा न उचलता. खांदा उचलू नको. सरळ बस. आता टेक बस. खांदा नको उचलू. गुड बॉय. बघू. खांदा नको उचलू. खांदा असाच ठेव सरळ. हे बघ सरळ. खाली ठेव, खाली ठेव. हात पुढे कर. आता टेक. आणि भूक लागते आता आणि शी झाली आणि ऍ कर. आ मोठा आ.
So what is the learning from this case? What will you understand from this case? What is the take home message from this case? Role of potency. Why not 1M direct? Why not 1M direct? Okay. What else?
Susceptibility pathology.
Because we had given lachesis 200 already, 3 doses. Okay. We had a good history of epistaxis, very clear left-sided only. And that is why we already had given 200 cases, which drained out the situation. The only question still I have in mind is, when the remedy had worked well, why the infection caused a meningeal irritation? That is still unclear to me. Why it went to, if the remedy is correct, we say that it should not cause any type of metastasis. So that is still I am unable to learn or understand. But meningeal irritation was very clear. He had a very projectile vomiting in the hospital clinic itself. You can see the neck stiffness. You can see the febrile state. All was there. And gelsemium was given because we were a little bit in question mark what to do, whether it's how to proceed further. Because of the dullness, drowsiness, neck irritation, and meningeal irritation, we started with gelsemium 30 very frequently, every hourly in water. And you can see in the next day a little bit of change. It was not a very good change, a little bit of change. So we went to gelsemium 200, after which the whole scenario changed. And that is why we did not go directly to 1M. We are dealing with something very strong of a mental irritation. So it should not cause any irritation. Laches is already given 200. What had caused really the meningeal irritation, I did not understand yet. This is my learning. But this is how I see how remedies, potencies, and the observation at that particular juncture should help you to pick up the remedies very fast. So your observation, your mathematics, as well as your repertory should be very good. So this is another case of acute respiratory, or we can say an acute bronchitis or cough.
Her name didn't come on the board.
Okay.
तो किसी फ्रेंड ने तो ऐसे वो किया कि देख हमारा नाम आया और तेरा नाम नहीं आया, तो 10 दिन से काफी डिस्टर्ब थी. But apparently then okay, I made her understand that we got 95%, which is also good. Then ऐसा कुछ.
What you can see, fast observations I should get from you.
Drowsiness.
Patient dull and sleepy.
Dull, drowsy, sleepy. What else? Anything else?
No response from patient.
We work hard this time. उसके बाद from 10 days, yesterday when she was playing, she was just playing it.
What did you see?
Screaming in sleep.
When did she say mama? When her mother started crying?
It gone out. And I asked her why. I don't want to play with them. Again, कल उसका जो she's taken part in the dance.
Can you see her abdomen?
Yesterday the teacher have shuffled everything. Again she got upset because of that. किसी का
पार्टनर चेंज कर दिए.
Abdominal respiration.
किसी का बर्थडे था, रिटर्न गिफ्ट आया था, तो वो कलर किसी के साथ एक्सचेंज हो गया.
और
From past 10 days she gets hung like when she's playing in between वो hang up हो जाती है, like as if something is going in.
Has she become alert? She was only drowsy when the mother was not speaking. When she started speaking, she became more alert. See the sternal notch and the abdominal respiration.
Tried to ask her over and over again. She's not able to vocalize it.
तो अभी ये जो रेस्पिरेशन है, जैसे पेट उड़ रहा है, गले में भी देखो, नाक, ये कब से है इतना?
ये आज सुबह से ज्यादा है.
सुबह से ज्यादा.
In the morning it was only heavy respiration था, but इधर थ्रोट तक था, अभी दोपहर तक पूरा.
सुबह से कुछ खाया नहीं खाया?
Not even water. She's not able to take water, no ORS, nothing.
She's not sitting at all?
She's not sitting.
Just lying down.
Yeah.
You're closing her eyes like this?
Yeah.
Kashvi, tell me what is happening? What happened? What happened? Tell me, beta. Why? Did you dance yesterday in the school? Yes or no? Yeah. You were very tired dancing?
Yes, tell me your observations. First day, what are you getting? Fast.
Abdominal breathing.
Abdominal breathing.
Patient is dull, but still answers correctly.
Yes.
Irritability.
Irritability. Where did you see the irritability?
She was not ready to answer. She gets irritated.
She did not want to be disturbed.
Ah.
Yes. Does not want to get disturbed rather than irritability. So all these differences do play a lot of role in homeopathy, whether it's irritability or whether it does not want to get disturbed. What else? So this was an acute case of what? Acute case of what?
Respiratory distress.
Respiratory distress. So she came with an acute respiratory distress where you can see there was a lot of abdominal respiration. There was a lot of sternal notch respiration. She was unable to sit. She wanted to lie down constantly. And there was an emotional turmoil in the school, which the mother was narrating. And something happened there and the whole scenario started. Okay. Now this is the first follow-up after 24 hours.
How are you? Tell me. बोलो कैसे हो?
क्यों लगे थे बेटा?
क्या खाए सुबह से? ऐसा खांसी है अभी? खांसी में कुछ निकल रहा है क्या? What is good then?
Good in the sense कि अभी थोड़ा freshness तो लग रहा है ना. She was able to sit for half an hour at least. She had papaya. One small bottle.
Okay.
And the medicine that you changed in the evening. One time nebulizing and twice in water.
2 बार गया. ठीक है. Continue. Nebulize और एक बार करो. उसी से पानी में 1-1 घंटे से दो. सुबह will see at 10 o'clock, 10-11 o'clock. Okay. She is good then, better than before. Nasal flapping कम है उसका. ये
अभी ये means ये काफी अंदर तक जाता था.
वो थोड़ा
कम हुआ है. नोज का तो
almost गया. पर उसका अभी आँख खुला है. She was totally drowsy. Drowsy state था सुबह.
अभी गले का है फिर भी.
है अभी भी है. Quite strong. Why is she complaining of this pain?
So what is the change?
Responding.
Responding to what?
Intensity of the symptoms better.
Intensity of the symptom better. Very good.
Facial expression of the patient also better.
Local symptoms are better. That the respiration, which was very fast, has become a little bit better. But what about the general state? Also better. State of consciousness is a shade better. She's opening the eyes, looking around. So this is the change. Okay. So we called her next morning, and this is the next morning.
So tell us, how is Kashvi today morning? Yesterday morning she was there. Yesterday evening you were there. Now it is 24 hours that you brought him. Tell me, how is she now?
In the morning she was having a little bit of wheezing.
No. Tell me last night after when you went back, when you came in the evening last night. What happened after that?
After we went back home at 8 p.m. She wanted to eat something.
Okay.
She wanted Maggie, but we refrained from giving Maggie. So I gave her dail. Khajur ki chutney wala. So she had this churmura, tomato and khajur ki chutney wala dail. And after that we gave her a nebulizer one time. Then the same medicine in water.
Nebulization by our medicine only.
Yeah, by
homeopathic medicine only.
Homeopathic medicine. Then half an hour after eating, we gave her nebulizing.
Okay.
Another after half an hour, we gave her the medicine in water. The same medicine in water. And then we applied. After that, we applied Vicks and we did a steak with salt.
Okay.
Rock salt.
Okay.
And we did that for another half an hour.
Okay.
Again, after a while, we gave her one more time nebulization.
Okay.
So she said, one more time nebulization. And
if you sit there, I can catch you. Not here. Sit Mama's lap.
अरे तारो वीडियो आपसे अंदर आई कौन है बेसिस
You have to speak.
तारो की वीडियो आवाना चाहिए वैसे सर बता सकता है After the sake, we did another round of nebulization and one more round of medicine. After that, she slept. By the time we finished the second round of medicine, the wheezing was quite low. Like compared to morning, it had come down by 80%. And at night, she was having a little bit of wheezing, but in the morning, it had come down again to 10%. After her bath, again we did another round of nebulizing. Before bath, we gave her nebulizing, and after bath, we gave her the medicine. After the medicine that has gone, the wheezing completely has stopped.
Okay.
So by 10 o'clock today morning, everything is.
So in 24 hours, everything is okay. 24 hours. Yesterday morning you came, now it's 24 hours. She is totally fit and fine. Okay. Now anything she ate since morning.
What cover? She had a cup of green tea. Did you eat anything after when they She had coconut water.
Okay, coconut water. Okay. So wheezing has gone. Her respiration is quite good. See, show me your abdomen. Pet batao. Everything okay. Everything okay. Chal. Everything okay. She's okay. Fit and fine. Quite happy. So let's see. Now you don't have to give nebulization. You have to do only. You have to give 3 times a day the medicine that we have given yesterday. And so tell us.
The wheezing.
He is totally fit and wheezing has gone. Her respiration is quite good. See, show me your abdomen. Pet batao. Everything okay. Everything okay. Chal. Everything okay. She is okay. Fit and fine. Quite happy. So let's see. Now you don't have to give nebulization. You have to do only. You have to give 3 times a day the medicine that we have given yesterday. And tomorrow morning we'll see. If anything, we can see you in the evening. Okay? Chalo. You have the medicines last night we gave you. Okay.
So this is the case. What to do? See, in 24 hours, the whole scenario changed. She came in the morning, first day, the same day evening, and next day morning. So fast homeopathy works. It was really an acute, a really bad acute, a strong respiratory distress. But you see in 24 hours, what things have changed. So what shall we do? Remedies in mind, anything? Anybody?
Antim tart.
Antim tart. What else?
Ignatia.
Ignatia. Why antim tart? Why Ignatia?
Because of the episode which happened at school.
Yes. It was more an emotional upset. It was more an emotional upset. But Ignatia mostly has what type of respiration?
Involuntary sighing.
Involuntary sighing. This was not sighing.
This was not sighing.
This was not sighing. So that is the differentiation with Ignatia. It is not sighing. Though there was an element of Ignatia. Who can tell that? Because when the mother cried, the child opened the mouth, said, Mama. Okay. She was lying totally listless at the first time, on the first day video. But the moment the mother started crying, she opened the mouth and said, Mama. That was the phase of Ignatia where we saw the emotional attachment. And that was where we also thought that, is it Ignatia? But the respiration was not really of Ignatia. It was not a sighing respiration. It was a really bad respiration. Somehow they have not put the reports here. We have done the reports also, and it showed really a very bad bronchitis, acute bronchitis. So why antim tart? Somebody said antim tart.
Flapping of nostrils, abdominal breathing, difficulty in intake.
Yes, lycopodium is also there. Flapping of the nasi. There is no rattling.
Drowsiness or aggravated after don't want to be disturbed.
So you see here, respiration rattling, respiration abdominal, nose motion,
Abdominal
swings
respiration.
fan-like. Okay. So you have antim tart, phosphorus, spongia, ferrum, lycopodium, arsenic, chelidonium, cuprum, iodum. So what shall we do now?
Antim tat, sir.
Phosphorus.
Antim tart. Why
Phosphorus.
Why?
Because the child is attached to mother.
What else?
Constant touch.
So this was the eliminating rubric. Nose motion, wings of fan like, nervous. Only phosphorus. So if you add this rubric to the first three rubrics, only phosphorus comes up very strongly with the confirmation. Now you can say the confirmation, the attachment with the mother, the liveliness of the child that you see in the third video. All these things are very clear going with phosphorus. The acuity, the amount, the acuity, and the strong aggravation phase that you see in phosphorus, a volatile nature that you see in the pathology also. So this was a very clear picture of phosphorus. Now what potency? Chalo, you people will guide me.
Sir, why you took that nervousness? Can you tell me, please?
It came after nervousness. Now we are talking about ignatia. So it was more of a nervous phenomenon. But it was not a sighing respiration, a really bad inflammation of the respiratory system. And that is why it did not go to ignatia. If it was a sighing respiration, it had gone to ignatia. It was the nervousness that was there in her. The nervous phenomenon brought the whole scenario. It started after that. The mother gave you the whole story. So nervousness was there. That is why it is an eliminating rubric. And where phosphorus comes very strongly. Though phosphorus was, we have to confirm from all these. How will you differentiate antim tart with phosphorus and with spongia? So that was how we differentiated, because phosphorus was there. But this differentiated or gave me very clear indication that it should be phosphorus only. Now what should be the potency?
200.
200. What else? And one
Only
more
one
thing we
dose.
learned in this case was, we nebulized the child with the same remedy. What we gave, phosphorus we gave, but we gave the nebulization also with the same remedy. And that gave a more better effect rather than only giving the remedy. So you can nebulize in acute cases of bronchitis, in acute cases of cough, with the remedy that you are giving, which you are very much clear that this remedy is clear. You can even nebulize the child or the patient with the same remedy that you are giving internally. So it was phosphorus, 200 followed by 1 m. In the morning, we started with 200. In the night when she came, we gave 1 m. And the second day of morning, we saw what happened after 1 m. So these are the cases that I have tried to show you.
Sir, with the same potency you gave in nebulization?
Nebulization.
1 m also same?
You cannot give nebulization 200 and orally 1 m. The same potency on the first day, we gave 200 internally as well as nebulization. In the evening when they came, we changed the remedy to 1 m, including nebulization as well as oral.
Sir, in
It has to be the
nebulization,
same potency.
sir, in nebulization, you put the liquid drops or the pills only we put inside?
Both can be okay. If liquid you can put, that is ideal. But
how many drops, sir?
2 drops, 1 drop or 2 drop, enough. Because hardly the nebulizer has 10 ml of liquid or 5 ml of water rather. So in that 1 drop is enough, or 2 pills are enough. So now any questions more? I think with each
Sir,
case we did the question answer session.
Can you throw some light on Morgan Pure in infants?
Morgan Pure in infants is very good remedy for any chest congestion in infants and children. Where we think of antim tart, where we think of tuberculinum, where we think of bacillinum, Morgan Pure plays a very good role, as we have seen here in streptococcin, staphylococcin, or penicillin. So Morgan Pure is a very good remedy. You can immediately give Morgan Pure wherever you see chest congestion in winters or change of weathers. Morgan Pure does a good trick or better change than bacillinum or tuberculinum or even antim tart. Psychotico for inflammations, joint inflammation. Anywhere you see inflammation, a chronic inflammation, psychotico also is a very good remedy.
Without swelling, only inflammatory reactions, can we try psychotic?
You can try, but you have to see how long is the inflammation, what you have. I am failing after giving a lot of rheumatoid arthritis, the inflammation is not going. Then I give a dose of psychotic. So you have to juggle with it. This is how, after seeing cases, various cases, chronic as well as acute. So we are now immediately when they come with an inflammatory situation, we try to give psychotic, whether it helps. We have seen that in chronic cases, but what in the acute cases? You have to see that. This is how you learn. But the conjunction with the repertory, with your mathematica, with the symptoms, with your observations, your minute observation, gives you a very good clue of your polycrest remedies, simple remedies, and rare remedies, what already you have in your whole of mathematica. If you do that, I think 80% of your practice goes very well, 80% of the practice. 10-20% you have to give to allopathy or to the higher centers. Otherwise, 80% of your regular practice, including acutes. If you do acutes so well, I think chronic you can manage very beautifully. Any other questions? No questions? All are tired. 55, 5 left already, 6 left. So, a big thanks to Dr. Preeti Shah, Preeti Vaidya, and Homeopathic Muslims platform to give me this today's platform to express my views, my ideas, and my experiences, to share them.
Thank you so much, sir. It's like, thank you from our side.
It
It was a much pleasure to have you on our platform, and the session was very interactive and very nice. Like, excellent session, and learned a lot from you, like a scope of homeopathy, basically a scope of homeopathy, and to remove that myth that homeopathy cannot work in acute cases. It's just a very good motivational for our homeopaths, for early homeopaths like us, who really needs this motivation and who really gets like confident enough to handle such cases. It was great session, sir.
Acutes are more important. If you manage the acutes, you can manage any chronic situation.
Yes.
And once you manage the acutes of a case, the whole family is attached to you. They know your caliber, your capacity, your capability.
Yeah.
So you have to put your impression. First impression is last impression. So put your impression with acutes. If you put your impression with acutes, I think no patient will go from you. Wherever you are, they will come to you. So do your acutes very strongly. So this is my sincere request to all the young budding homeopaths, that no acute should be sent to allopathy. If they are in your limitations, you must give a good chance to treat them with homeopathy with positive results and successful results. Thank you once again.
I have a question. Sorry.
Yes.
Hello.
Yes.
Yeah.
Yes. Yes.
Very nice session, sir. My question is, in the last case, the position, the way the child was sleeping, should we take that into observation? Like her knees were drawn upwards, and then there was no covering. The way her dress was also worn, so all that.
No. Now the position will only be important. Your observation is very correct. The position will only be important when it is to be taken into consideration. When that is important. When the child is having a difficulty in respiration, and sleeping in that position makes him better. That is her regular position that she sleeps. This is a good question. That is because we asked the mother, this is the way she sleeps always. If there is this position is sleeping and always, has no meaning or no importance during this acute phase also.
Okay.
If a child is having an asthmatic attack and is better by lying on abdomen, then medorinum is the remedy. But the child always sleeps on the abdomen, even during the acutes, does not give you a good indication for medorinum. Very clear?
Yes, sir. Thank you.
That is why the position did not help us in distracting the remedy. That is why when you see, your observation has to be very keen, what to be asked, what not to be asked, what taken into consideration, what
But
not.
sir, one question, but it is still there in the acute, so because what is there in the plan, we say na, ki it is still come up in the acute, right?
Yes, yes, yes.
So we
But
can
that is
take
why
like
we asked her ना कि बाबा घर में कैसे सोती है,
correct.
हमेशा हमेशा वैसे ही सोती है वो, पैर ऊपर लेके. तो
Okay.
अभी दम में या तकलीफ में भी पैर ऊपर लेके ही सो रही है, वो उसका रेगुलर पोजीशन है.
Okay.
इसलिए उसका इतना इंपॉर्टेंस नहीं रहा.
Okay, sir. Thank you.
Anything else? Okay, so a good session. I think I'm happy that all this 63, 45 remaining, all people attended the afternoon session, though it is a drowsy state session. I think Musing should change their timings rather than 2 to 4, it should be. But Bombay people are not tired. From morning to evening, they are working. So for Bombay,
Yes,
2
sir.
to 4 is a good time. So they should not waste their time. Morning, evening, they are back to work. In the afternoon, they can do such sessions.
You made the session very active, sir.
Yes, sir. It was very
I tried to
active.
do
Lively session, sir.
Yes. I tried to do whatever best, and I tried to give whatever best is possible without any hinge or hint. So this is what is need of the hour for homeopaths. There should be a crystal clarity in your mind, and that crystal clarity only will give you a good confidence. That confidence can take only to you, will give you to move ahead very fast, and will boost homeopathy also. Thank you with these few words. Okay, bye.
Thank you. Thank you so much, sir. Thank you, participants, for joining us. Yeah, for a very odd time, 2 to 4, but yeah.
आणि कोण कोण होतं आपल्याला सापडेल?